Here we have it. One of the greats. Muhammad Ali on the right, fighting Joe Frazier on the left. They fought 3 times for the heavyweight championship of the world. Muhammad had it all. He had the jab. He had the hook. He had the uppercut. Unfortunately, he took too many blows to the head. And I'll be talking about that problem shortly. Right now, let's look at the cranial meninges that cover the brain. We have the dura mater on the outside. 2 layers, I'm not going to worry about the names of those. The arachnoid, which has an arachnoid space where cerebral spinal fluid flows our entire lives, brain to spinal cord. And on the inner layer, up against the tissues of the brain with nerves and blood vessels, is the pia mater. Hydrocephalus is pretty serious because we have excess cerebral spinal fluid backing up because there's some kind of obstruction that's preventing it to flow from the arachnoid space into the brain and spinal cord. Infants have these gaps between their bones, the fontanelles here, and that allows some bulging to occur in hydrocephalus. But adults, we don't have that, and so sometimes a drill needs to be used to relieve pressure. CVAs or strokes, that's what we call these in the workforce. Technical name, cerebral vascular accident. And that is when there's some kind of obstruction. Sometimes it's due to a clot, such as a clump of blood cells that have floated and got hung up somewhere. Atherosclerosis, that's where we have plaques. Or intracerebral hemorrhaging. So intra means within, bleeding in the brain or pia mater. A TIA, or a transient ischemic attack, it tends to be something like a stroke, but it's a temporary cerebral dysfunction. We have partial blockage, so it's not a full blockage like we would have in a stroke, but it's often an early warning sign. It may only last 5 to 10 minutes and no permanent damage, so sometimes the people, they don't do anything about it. They feel dizzy, weak. There's a little numbness on one side, perhaps, and then they go on with their day until they get hit later with a full stroke. You can see the far right, the blockage, but there's still some blood flow happening here. Alzheimer's causes can be genetic, environmental, such as blows to the head, and that's what Muhammad Ali, he got Parkinson's, but he also has some dementia going on related to Alzheimer's. We have some kind of structural abnormality of the brain. It could be a plaque or tangle. Take a look to the right, lower right here. You can see these tangles here, and the plaques aren't shown real well. They're amyloid. At first, patients they're forgetting recent events. They'll remember things happened 50 years ago, but they forget what happened last week. They'll repeat questions. They'll get confused, sometimes lost on their way to a place they've driven to hundreds of times. Eventually death, because they can't even do some basic functions. They're bedridden and they die of pneumonia or something that we see in patients in this condition. All right, most students take a psychology class, so they spend a whole semester on the brain. I'm just going to skim through it. We'll look at the cerebrum, which is going to process sensory information coming in from the body. It's going to integrate information. It's the seat of our intelligence, memory, and personality. Diencephalon is just a region here wedged within the cerebrum. And we have the thalamus, which here looks like almost an eyeball. And it's going to relay sensory impulses to the cerebrum. The hypothalamus, see that prefix hypo. It's going to be under the thalamus, and indeed here it is. Its job is to regulate body temperature and some of our autonomic systems. Many of the organs, the squeezing of the stomach and so forth, eating and drinking. Epithalamus, we often think of the pineal, and it's not labeled here, but I know it's between the cerebellum and the thalamus. Yeah, it's right in this situation here. And that's where the pineal is for releasing melatonin, so we get sleepy before bedtime. Continuing the functions here, cerebellum, posterior side of the brain. This is our kind of our coordination center. It influences our movements, our postures, our balance, and so forth. Midbrain is for relaying of motor output from the cerebrum. So when I say motor, that means, okay, we have sensories coming in, We have interneurons in the brain telling us, kind of processing it. The motor neuron is going to tell the body what to do. Pons is going to relay impulses between the cerebral halves. Now, it's not the only one that does that. We have a connection here as well, corpus callosum. Medulla oblongata, sometimes called just the medulla, is a relay region. And take a look at this where it's positioned. It's between the spinal cord here and the brain. So it is a relay center between those two. Cranial nerves looks frightening at first, but we take them in order and we spend a lot of time until they get familiar. Olfactory, that word means sense of smell. It's up here in the front, anterior region. Optic, vision. Oculomotor, so we know it's a motor nerve. It's going to cause something to happen. And if it's ocu, then we think of eyes and lens movement. And there's the oculomotor. Trochlear, here is eyeball movement. It's not the only one that does that. Trigeminal, off to the right, this huge cranial nerve, is for touch, pain, face sensation, jaw movement. Abducens, here we have. Now remember, these are paired. There's 12 pairs, so it's not that the abducens is just here. There are pair abducens, both these purple ones, and there's a pair of trigeminals, pair of trochlear, and so forth. The abducens, eyeball movement, so there's another eyeball motor nerve. Facial, off to the right, green here. Taste, touch, pain, tears, among others. We have the vestibulocochlear. I don't know why I'm having trouble with that. Here it is. That's going to be hearing and balance. And I'll talk a little bit more about this later. Glossopharyngeal. Glosso means tongue. And throat. So it's taste, touch, swallowing. And people that have problems with the glossopharyngeal have trouble swallowing. Vagus is a very busy nerve. Here it is. Number 7. And it's going to be involved with taste, blood pressure, heart rate, and many other functions as well. Accessory, down here, the head and shoulder movements. And hypoglossal is speech and swallowing. On occasion, our trusty truck acts funny, very good vehicle anyhow. Okay, so olfactory, optic, oculomotor, trochlear, right, come on, where's the trochlear? That's kind of, okay, yeah, that works. We try to do these in order, and there are many different types of mnemonics. This is just one. It's a clean one. Some of them are not so PG rated. But I think it helps at first just to get the order. And then once you get the order, then you start, you just start understanding the words. Olfactory, smell. Optic, eyes. Oculomotor, movement of eyes, and so forth. Let's look at some diseases. Anosmia, which I don't hear about very often. That's a loss of sense of smell due to injury or infection, including the olfactory nerve. So there's the olfactory bulb, and the nerve is leading away right here. Olfactory nerve. The anopia, a little more common, is when we have defect of the optic nerve. So let's take a look here. And what's kind of bizarre is that the optic nerve leading away from the eye towards the cranial section of the cranial nerves, you can see the different parts of the nerve will cause different forms of eyesight. Strabismus, this is relatively common, although not as extreme as this. Both eyes are not fixed on the same object at the same time, and that is due to oculomotor damage. And you can see the oculomotor nerve here, and its position here in the inferior part of the brain. Bell's palsy. Now, sometimes this is temporary. There's some kind of paralysis of the facial muscles due to infection, or it can be permanent. It just depends on what's causing it, and often the cause is unknown. Vertigo is when we feel dizzy, like things are spinning. That's typical. And that's due to the vestibulocochlear nerve. And take a look at that. It's leading here to the region of the semicircular canals. And we know that those are involved with balance. Dysphagia. There's lots of reasons for dysphagia, and that's when people have difficulty swallowing. And sometimes it's due to damage to the glossopharyngeal or the vagus nerve. And here's an image of the vagus coming down. It also influences the gag reflex or pharyngeal constriction of the throat. If you ever had something in your throat and you start gagging, that's a survival response, but it sometimes interferes with us trying to insert like a tracheal tube or something. Okay.